Welcome back to Daniyal Ultrasound Clinic. This is Dr. Munir Abbasi. Today we have got topic of free peritoneal cavity fluid. So let me show you. This is urinary bladder. I'm scanning the lower abdomen of the patient, adult patient, which is showing this free hypoechoic area, which indicates the free fluid. And these are guts which are floating in the fluid. We have few things to discuss or describe regarding the free peritoneal cavity fluid. These are consistency of the free peritoneal fluid, which is very important to understand, and the causes. So on ultrasound scan, free fluid in the peritoneal cavity appears as anechoic or hypoechoic collection between abdominal organs, like I showed you just. It is surrounded by the it is surrounding or around the distended bowel loops. It's usually first detected in the dependent areas. That's why I am scanning in the lower abdomen. The dependent areas could be Morrison's pouch, that is between liver and right kidney, perisplenic regions, pelvic cavity or pouch of Douglas in female, or paracolic gutters, and between bowel loops if it is generalized ascites like this. So when the amount of the fluid increases, the fluid spreads freely throughout the peritoneal cavity or peritoneal spaces and may cause bowel loops to float or move with respiration, like I just showed you. So regarding the consistency of the peritoneal fluid, it is very important to understand. First of all, the echogenicity of the fluid gives important clues to its nature. Like if the fluid is transudate, it would be shown as completely anechoic black area, and even if you move the patient passively, it doesn't show any kind of echoes. So it is called anechoic fluid. And another is the exudate. Definitely, you will be understanding the word exudate. There would be low-level internal echoes like fine particles swirling in the fluid. And another consistency, it could be pus or pyoperitoneum. There would be echogenic or turbid fluid with debris or septations. There would be thin septations or thick septations, that depends upon the disease. And chylous ascites. So this is there would be mobile internal echoes with swirling sinuostorm look. And hemoperitoneum, there would be echogenic fluid with layering and culottes. Another variety is loculated fluid. It would be thick-walled or septated collection, or looks like encysted inflammatory collection. So once again, I repeat that normally a very small amount of lubricating fluid is present in the peritoneal cavity, but if it is in a moderate or massive amount, it is pathological. So this normal amount of fluid sometimes is seen, sometimes it is not visualized. It allows smooth movement of the intestine. So now let's go to the causes of the peritoneal cavity fluid. There would be systemic causes like transudate causes, say for example liver cirrhosis, congestive cardiac failure, nephrotic syndrome, severe malnutrition, and the another big variety is inflammatory causes or infective or exudative causes. So say for example like peritonitis, pancreatitis, appendicular or pelvic inflammatory disease, especially in females. And the third big variety is the hemorrhagic causes. Hemorrhagic causes includes trauma to solid organs, liver or spleen ruptured ectopic pregnancy in females especially, and ruptured aneurysm. or post-surgical bleeding. The fourth variety is neoplasms, definitely. So this would be peritoneal carcinomatosis. Fluid may appear echogenic with fine internal echoes, and or maybe the ovarian, gastric, colonic cancers, which may cause malignant ascites. So fifth big variety is chylous or lymphatic causes like lymphoma, tuberculosis, or postoperative lymphatic leak or chylous or milky fluid. So this was all I wanted to tell you. Now the real time shows us hypoechogenic area, hypoechogenic space around the distended bowel loops. Bowel loops. These bowel loops are distended though, but they are normal. So we have to search or explore thoroughly the patient for these possible causes, as I told you, and we have to relate those findings with the causes to come to a definite diagnosis. But definite diagnosis is definitely done by paracentesis and other methods which may bring us to the definite diagnosis. So here is the peritoneal fluid. These are GERDs. This is urinary bladder. This is a longitudinal section taken. We have discussed a lot about the causes and consistency of the peritoneal fluid. Though this is a rare topic, but I thought it suitable to share with the students or the people or the doctors who are interested in this field. So thank you very much.